1. SARS-CoV-2 antigen detection kit colloidal gold method. 2. Allow the test device and specimens to equilibrate to room temperature, 1530 degrees Celsius or 59-86 T, pour to testing.
This test card can be used for home testing. The kit consists of test card, antigen extraction tube, containing antigen extract R1, swab, manual and biosafety bag, extraction reagent and test cassette.
Test procedure. Put the antigen extraction tube on the Walker station. Sample collection. Remove the swab bag from the picture. A nasal swab sample. Head patient's back about 70 degrees. Let the patient's head relax naturally, and slowly rotate the swab against the wall of the nostril into the patient's nostril to the nasal palate, and then slowly remove it while wiping. Throat swab sample. Let the patient's head tilt slightly, mouth open, and make sounds, exposing the pharyngeal tonsils on both sides. Hold the swab and wipe the pharyngeal tonsils on both sides of the patient with a little hard back and forth at least 3 times. Unscrew the purple cap of the antigen extraction tube. Place the swab specimen in the antigen extraction tube. Rotate the swab for about 10 seconds, and press the swab head against the tube wall to release the swab antigen. Screw on the purple cap of the antigen extraction tube, and place the antigen extraction tube on the workstation. Open the aluminum foil bag, take out the test card and place it on the desktop. Unscrew the white cap of the antigen extraction tube. Apply 2 drops of extracted specimen to the specimen well of the test device.
Read the results after 10 minutes. Strong positive results can be reported within 10 minutes. However, negative results must be reported after 10 minutes, and the results after 15 minutes are no longer valid.
Interpretation. The result. Positive result. If both the quality control line C and the detection line appear, SARS-CoV-2 antigen has not been detected and the result is positive for antigen. Negative result. If there is only a quality control line C, the detection line is colorless, indicating that SARS-CoV-2 antigen has not been detected and the result is negative. Invalid result. If the quality control line C is not observed, it will be invalid regardless of whether there is detection line, as shown in the figure below, and the test shall be conducted again.
Put the used nasopharyngeal swab, antigen extraction tube, antigen extract R1 and test card into the biosafety bag. The used test cassette should be discarded according to the authorities and local regulations.
Limitations. The product is limited to provide a qualitative detection. The intensity of the test line does not necessarily correlate to the concentration of the antigens in the specimens. Negative results do not preclude SARS-CoV-2 infection and should not be used as the sole basis for patient management decisions. A physician must interpret the results in conjunction with the patient's history, physical findings, and other diagnostic procedures.